I'm very happy today to introduce Cynthia Oxman. She is a retired social worker with extensive experience in palliative care, and her topic is navigating the caregiver issues, the challenges and the solutions, and understanding the caregiver hurdles and effective strategies. Welcome, Cindy.
Thank you, Brenda, and hello, everyone. Brenda just recently posted a presentation about compassion fatigue, and I'd encourage everyone to have a look at that. But I'm going to talk today about compassion fatigue and caregiver support primarily in the context of family caregivers. Family caregivers, as defined, is members of family who assume the bulk of the responsibility of caregiving to a family member who has become ill. I will talk about some of the challenges faced by family caregivers, especially the principal family caregiver. But I'd like to focus more on prevention, which will include recognizing risk factors and symptoms. And I'd like to end by suggesting some strategies to prevent or at least cope and manage through the caregiving role. Just run through a little bit about the agenda. We'll talk about understanding the role of caregivers, some common challenges faced by caregivers, and managing physical and emotional well-being. We'll talk about financial and legal considerations and also about building a support network. Some of the responsibilities and changes that family caregivers experience include anticipatory grief, which are those feelings of grief and loss in anticipation of an expected loss. They may also experience physical fatigue and anxiety that comes from the role of caregiving that is now added to your already busy life. Time management is an issue, and as I mentioned, there are emotional and stressful feelings that arise with having less time, being physically fatigued, and of course, that constant emotion of worrying and wondering about your loved one. Financial stressors include changes in income as a result of the person who is ill no longer being able to work, and sometimes by the family caregiver who needs to take time off from their work to provide care and manage appointments and so on. There may also be additional financial costs, such as added medications, supplementary medications that may not be covered by any healthcare insurance or extended health benefits. They may involve purchasing some equipment or adaptive adaptations that are required in the home to enable your loved one to be as independent as possible. Role changes. An example might be sometimes the person who has become ill was always the primary decision maker in the family, and they now have to adjust to needing help with those decisions. Conversely, the caregiver may not be used to making important decisions or may not have been involved in making those decisions, and now they have to assume that primary responsibility. Legal issues that arise may include formalizing decision-making, estate planning, and identifying how and with whom medical information can be shared. The lack of privacy and maintaining boundaries becomes an issue. When a person becomes ill, the family caregiver and family members are immersed in meeting with many new people who have been strangers up to now, and they're now expected to disclose a lot of information that they feel very private about. They're meeting so many healthcare teams are often large and extensive. They may include they always include your physician, nurses, often physical therapists, occupational therapists, pharmacy becomes an important member, social work, sometimes your chaplain in the hospital are all members of the healthcare team. And you find yourself having to meet these people and develop trust in a relatively short period of time. And to establish boundaries as well with who and what medical information you want shared among your neighbors, your friends, other family members. So there are a lot of important decisions to be made. when I talk about conflict management, I don't want to alarm you, but that often refers to issues that may arise among and between family members around care management, medication management. There may be people may have different opinions and perhaps some of them uninformed opinions about narcotics to manage pain. They also conflicts could arise with your healthcare team. And maybe the healthcare team is trying to work faster than either you or your loved one is able to work because of the emotions that you carry that they don't. So these issues can result in physical and emotional issues for the caregiver. Now, I apologize if my presentation up to now sounds frightening. However, I do feel that in anticipating these issues can and will help you to be in a better position to plan for them and to be more aware of those feelings and emotions that arise so that they're not just coming in from left field. Most importantly, I want you to be kind to yourself when you do feel these overwhelming emotions and feelings. And when you're feeling exhausted and questioning yourself and wondering what's wrong with you, because there isn't anything wrong with you. Let's talk about self-care. Self-care is absolutely essential for caregivers to maintain both physical and emotional well-being and for preventing burnout. One of the most recommended strategies is to take time out for yourself to do regular exercise. So incorporating regular exercise into your routine, whether that's a walk to park your car further away from your appointments or your work, if you're still working and that kind of thing, incorporating, just take that time out to walk and get those endorphins moving because exercise can help reduce stress levels. Healthy eating, maintaining a balanced diet and keeping hydrated and keeping themselves as well as possible to help you sustain your energy and your overall well-being. Take breaks. Taking breaks help caregivers recharge and enhance their ability to provide effective care. Accessing mental health support when you're experiencing these signs and symptoms of emotional distress is essential for caregivers managing stress and emotional burdens to help you cope and ensure your well-being. Available resources can be something as informal as a very close friend who is there to just listen and hear you and to empathize. It could be more formal resources such as counseling and support groups through nonprofit associations in your community. Our own organization, CHCC, is posting presentations like these, and as well, we do have a family support group available. Other resources that may be in your community might be a provincial mental health association. The Alzheimer's Society has caregiver support groups, a little bit different than what you're dealing with, but some people do find that supportive if there are no other groups in your community. If you're someone who likes face-to-face meetings, you might want to check with your local cancer society, who may be running some caregiver support groups as well. And please seek help from your physician if you're experiencing any physical signs of caregiver fatigue, such as sleep issues, loss or changes in appetite that are resulting in either weight gain or loss, physical symptoms such as pain, skin outbreaks, or other symptoms that might be suggesting potential health issues. It's important to check all insurance coverage that may be available, including life insurance, extended health benefits through both your and your loved one's employment, GoFundMe options if needed. Some life insurance policies have clauses that allow the policyholder to access the funds from that policy early if the disease is considered terminal and incurable and the time frames that they require. So please check with your insurance advisor to see if you may be able to access funds in that way. Navigating insurance and medical costs. As I mentioned, please understand your coverage. Um, Understand what provincial coverage is available to you. If you or the ill family member has extended health benefits through work, speak to your human resource officer or have someone help you go through them and see just what resources are available to you. It's important to advocate for services, especially with your healthcare team. So, home care may be able to help with more physical care so that you can maintain the relationship, particularly in the case of spousal care. They also may be able to offer you some respite care, meaning that you may be able to take some time out for yourself to do those things like exercise and go to counseling appointments or support groups and that kind of thing. So please consult with your home care case manager to see what resources are available there. And managing medical expenses is essential to alleviate financial stress and provide quality of care. So find out through your pharmacy, can they direct bill your extended health care coverage or the province for coverage. Many provinces have what's considered palliative care benefits that are different than what may already be covered under your provincial care plan. Check the new pharmacare regulations. Again, your pharmacy or social worker should be able to inform you and help you with accessing those benefits. I want to talk a little bit about legal rights and protections for patients and caregivers. I know this is overwhelming, and I can't imagine meeting all of these new people, having all of these questions, and wondering who's going to be the best to answer these questions. I can't imagine how difficult that might be. But I do want you to know, and your loved one who is ill, to know that you do have privacy protection in Canada. In every province, there would be some legislation to protect your patient's privacy. It's important to make sure, and I think probably the social worker at the hospital would be best, or your physician, to discuss this with your loved one who is ill, may have to sign patient consents to specify exactly what information and with whom that information is to be shared. Sadly, in the old days, because doctors assumed that families were there to be helpful, they tended to share information with just about anybody who asked. Now it's important to be very clear about what information you do or your loved one wishes to have shared. Access to resources, again, check with your social worker, check with your case manager from home care to see what supports can help you. And they are usually a wealth of information about local community resources. Understanding your legal rights, your patient's legal rights, or your loved one's legal rights empowers both the ill person as well as the caregiver, and it helps you be in a better position to advocate for those resources and supports. Family members and friends may want to help, but they don't know how. If you can, and it is difficult, communicate clearly about your feelings, your needs, and how they can be helpful. If you need a friend to just listen and not offer advice, be clear about that and just say, I just want to dump. I've had a horrible day. I just need to unload this. Again, advocate for respite care services so that you can have that temporary relief and time to focus on yourself. That's so critical. And most home care agencies should provide you with a portion of that. You may need to access more informal, asking a friend or a family member to come in and stay with your loved one while you're on an appointment or while you're out taking a walk or go to the gym or whatever. And again, support groups. Access those if and when they're available, because I think caregivers who have also experienced what you're experiencing, it will be different, but you're all experiencing many similar issues, and you may learn from that how they adapted or adjusted. and help themselves and improve their well-being. So in conclusion, we've talked a lot about your role as a caregiver and the challenges that you face. We've talked about self-care and seeking support and resources. But I want you to know that you aren't alone and there are resources. And even if it feels sometimes that you can't face another day, getting the right help and taking care of yourself and being kind to yourself will get you through this. Thank you, and I wish you all the best. Bye now.
Thank you very much for attending this webinar. We have contact information if you need to ask any questions. Thank you, Cindy. The caregivers are the backbone to our healthcare system, and I really appreciate you explaining all that and recognizing their need for self-care themselves without feeling guilty is an important message to give.
Thank you, Brenda.